Hi, my name is Dennis Digger, founder and CEO of Optonome, the mobile communications training and management platform covering the entire spectrum of home and community healthcare. Our first iteration, Amity Cloud, was a native application launched in the iOS and Android app stores in 2014 and used primarily by direct support professionals working for Medicaid home health agencies offering home and community services to adults with autism and intellectual disabilities, helping them become more independent while staying in compliance with less paperwork. Let me explain why such a solution is needed and why we improved it over the years. Running a home health agency is very difficult. It's complex and expensive. And in fact, the traditional methods are just not working. You have to hire, you have to train based on state regulations. You have to train them again based on the individual support plan. And then you have to do payroll. You have to manage the home based on state regulations. And then you have to document everything to make sure you can bill on time. And if anything goes wrong during that process, you're paying somebody overtime. And it's costing the industry more than $6.6 billion a year. Early on, while running my own agency, I felt the strain myself, with turnover and trying to meet local, state, and Medicaid compliance requirements to bill on time. And now the industry recognizes the need for Optonome even more, with published articles discussing the strain on federal and state budgets and how turnover and traditional methods are affecting the U.S. economy to care for more people. It is known in the home healthcare industry as the DSP crisis because direct support professionals are the #1 growing profession in the next 10 years, and they receive non-living wages, meager benefits, and overtime hours without any career advancement, forcing them to depend on government subsidies and low-income housing, just like their clients. This type of strain forces DSPs to quit at alarming rates, leaving the home health industry in disarray. With these problems in mind, we built Optonome to be free for the general public, with HIPAA-compliant messaging and training to be a DSP based on state regulations. Once certified, DSPs can care for their loved ones or become employed by local Medicaid health care providers, saving providers costs before hire with an instant onboarding process. I call it inbound hiring. Get certified, set your schedule, and onboard to provide customized health care or housing to disadvantaged populations based on certified skills. Using Optonome, these certified DSPs can automatically document individual support plan information, housing, and regulation requirements using our beacon sensors, earning higher wages with benefits as they help providers lower administrative costs. While competitors are focusing on part of the problem, we're providing a complete solution, saving providers up to 95% compared to traditional methods. We built a platform that can manage the toughest regulations of Medicaid and Medicare to help home health providers stay compliant and care for more people, with less paperwork and less allegations of abuse and neglect anywhere. As we expand, we're taking advantage of a vertical integration opportunity of managing mixed-use properties and the people that occupy them with 7-star services they desire, using our existing infrastructure, similar to how Amazon created AWS, but for social impact, offering communication, training, and management services through Optonome, helping disadvantaged populations receive discounted housing and healthcare with higher wages. As an investor, we're inviting you to be a part of a new way of lowering real estate and healthcare costs and being a force for social good. Our goal is to reverse low-income areas from being pushed or bought out by building communities that can sustain themselves by circulating money within them, using in-demand professional skills, attracting individuals requiring quality healthcare in a home of their choice.